There's no doubt that COVID-19 has been a time of stress and uncertainty for people, but how do we deal and respond to that stress? Joining us with Gateway Family Services of Illinois is CEO and lead therapist Michael Rimley. Hey, Michael, how are you?
I'm great. How are you, Heather?
I'm great. So I love what your organization is all about, helping people navigate stress and trauma, which, this has kind of become a traumatic event for people.
Yes, it has. Yes. And I think that there is an opportunity for us to really use the stress. I mean, stress is not a bad thing. If you think about it, a lot of times stress helps us focus on a test or a particular job, a project that we have to do. It's what motivates us. But what is a key component in determining if stress is a negative thing is the pattern of stress. And so that's what we've really been trying to focus on is how do we navigate COVID-19 in a way that stress doesn't move us in a negative way. The idea behind this is we talked about the pattern of stress, and what makes stress negative is when it is unpredictable, it's extreme, it's prolonged. That's what moves somebody towards that place of sensitization or being vulnerable. If on the other side of that, what moves someone towards a place of tolerance or building resilience is when we can help make that more predictable and controlled and more manageable. That is what we need to be working on. So you may be wondering, how do we do that in the midst of COVID-19 when there's so many questions? And that's what we've been trying to work on with our families.
So how do we do it?
Yeah, good question, Heather. And there's another slide if you want to take a look at that. This talks about how we can move towards that place of resilience in the midst of COVID-19. So things that we can do, like daily structure, family meals, limiting your media exposure. We all want to just figure out what's going on, and we're on social media, we're watching the news. There's a time for us to do that, but then there's a part where we need to take a break from that and step away. Exercise is a fantastic thing. Reaching out to other people. This could be done through Zoom, text, FaceTime. Get creative on how you can reach out to people. Helping others in whatever way you can is another good thing, not getting so focused on ourselves. As well as sleep hygiene, meaning that we're having a consistent bedtime and we're having a chance to wake up at the same time. We don't have to be rigid about this. The other thing that, a lot of people have had a difficult time. We had a commute, a small commute, even if it was 10 to 15 minutes in the car from work to home. And now our work is in our homes. And so figuring out how do we make that transition from I'm at work to I'm at home is really important. So a simple thing, another therapist, she changes her clothes at the end of her work day into her home clothes.
Oh, there
And
you
so
go.
that helps her mentally shift from that. And that is moving her towards that place of resilience.
There you go.
Now,
Okay, then you've got one final slide to check out.
yeah, so these are things that would move us towards that place of vulnerability. So if we don't have structure in our day, if we're comfort eating, those sweet, salt, fatty foods, those are things that we want to eat a whole bag of Oreos in one day. Maybe not the best thing. Having too much media, minimal exercise, really isolating from our friends and our workers, coworkers, and our family. Really starting to focus on all the stuff that impacts us and how, kind of that woe is me. And then sleep disruption. If we're not getting a consistent sleep pattern, that's huge. And then just really focusing on all the negative things that are happening. Those are ways that we move towards resilience.
Hey, how's your sleep pattern going there with twins at home? I can hear them in the back.
You know what? It's been tricky. I will say that.
I bet. And so you're also saying don't eat a whole sleeve of Oreos.
Maybe not every day.
Okay. But also, I want to show some pictures quickly because we're about out of time. You use therapy with horses, which I love, and you've been very active with that still, with the social distancing and all of that. But you help anyone from youngsters to people in their 80s.
Correct. Yeah, and we have had to get a little bit creative on how we're doing this right now, but we're hoping to be able to move back into in-person sessions here shortly. So we've had to get creative on how do we incorporate horses as part of the telehealth services that we're providing. So all of our horses have been sending cards to their buddies and things like that, just to make it, we're still connected even though we're not together.
Yeah, well, we appreciate the work you're doing to help everybody's mental health stay on track, and give our best to your family because we love them as much as we love you. And if you want to connect with Michael and his team there at Gateway Family Services of Illinois, check out our website, CILiving.tv, and we'll get you connected. Michael, thank you so much.
Thanks, Heather.